I'm Dr. Shadine McLean. I'm a medical doctor working in the public sector. For health promotion, prevention is important, where screening tests is involved. For our breast cancer, for persons that are 40 years and older, we typically do mammograms. It's a imaging test that is done on both breasts to look for abnormal tissue. For persons that have higher risk factors for breast cancer, including those persons who have had breast cancers before or had a first-degree relative with breast cancer, or they have had exposure to high-risk radiation to the chest, those persons can have the screening test being done earlier at around 30 years of age. For cervical cancer, the pap smear is one of the well-known screening tests that is available here in Jamaica. For persons that are 21 years and older, up to 65 years, we say, you can do your pap smears. If it's normal, then we tend to repeat it every 3 years. For persons who are 30 years, they can do both the pap smear as well as the human papillomavirus testing. So human papillomavirus is basically the cause of cervical cancer, and if we can pick it up itself. So doing the test with the pap smear, it's a higher yield. And for this test, if it's normal, we tend to repeat it at 5 years interval, as opposed to just doing a pap smear by itself. For cervical cancer, we have an HPV vaccine available. It's available for persons, especially girls that are aged 9 to 14, which covers around the primary school to high school age. It typically is the best time for giving it at that age before they start having sexual intercourse. It can also be given for persons up to the age of 26, both male and female, as we know, because HPV doesn't just cause cervical cancer, it causes laryngeal cancer, which is cancer of the throat, and anal cancers as well. In addition to this, we can give for persons ages 27 up to around 45. It's still available, but it's for mostly high-risk patients around that time. So you can speak to your health provider or your obstetrician and gynecologist and ask them about the same.